Normal aging is not the same as healthy aging. Bank for your healthiest years. Hi, Dr. Tom here. If you missed our webinar or our open house, I'm going to fill you in on some really exciting information about our new Harvest Center at the clinic for stem cell banking. So what I'm going to cover today is, of course, why mobility is so important to healthy aging, what stem cells are, what they do, which stem cells are best, and what the FDA policy is and other political issues, how harvesting, banking, and treatments work, and who qualifies, what your next steps are, so that you can ask the questions that you need to ask in order to avail yourself of this fabulous new therapy. So I do want to take a minute and turn normal aging on its ear, because normal aging is not the same as healthy aging. Aging occurs from time, gravity, wear and tear. It affects most commonly our joints, but it also leads to sag and falling tissues, whether it's in the pelvis or the skin of our face. We know what aging feels like. The problem with the wear and tear on our joints is that the cartilage wears out, the tendons become less elastic, the ligaments become more brittle, the bone will actually begin to scar, and with that we lose strength, balance, and agility. And falls, as you've heard me say before, are the leading cause of injury-related death in both males and females 65 years of age or above in the United States. And it's going up every single year. We much rather, as we age, be youthful, active, mobile, balanced, and agile, and enjoying playing with the kids, playing with the grandkids. And the other thing is that this achiness and stiffness, it actually affects our sleep. It even affects our sexual intimacy as we age. Now, there are mobility assisting devices like crutches, walkers, wheelchairs, but I don't think any of us plan to be using those in our older age. I don't think our parents planned on that. I don't see any of our patients signing up for personalized license tags for those things. They do allow us to remain social when we do become disabled, but let's do something a little bit more proactive than that. In addition to the simple loss of mobility, with aging, we tend to see the burden of chronic disease. You know what I'm talking about: high blood pressure, heart attacks, strokes, cancer, chronic lung disease, those sorts of things. Then we don't know how to predict it. We don't know who's going to get it. But then there's a whole class of what we call neurodegenerative diseases, like Alzheimer's or Parkinson's, God forbid, things like ALS, multiple sclerosis, rheumatoid arthritis, other autoimmune conditions as well. On this slide, you can see I've listed the top 15 causes of what we call the chronic burden of disease related to aging. I've highlighted in red the ones that the current science of stem cells is greatly mitigating the suffering in these individuals. May not be quite at the point of curative, but it will greatly enhance your life, your quality of life, your lifespan, if you have or develop any of these diseases. I've also marked in yellow some of the conditions that I've personally seen in our clinic wonderfully respond to stem cell therapy. Returning to mobility, we know from the centenarian study, the study where we studied people living over 100 years old worldwide, that there are two determinants of happiness and fulfillment at age 100, and that is mobility and social relationships. As our mobility collapses or becomes limited, our social relationships also collapse, and that leads to a very terrible quality of life. When it comes to degeneration of our joints, you guys know the drill from conventional medicine. It's prescription pills, it's cortisone injections, and then eventually you're gonna need the joint replacement. You know what? The prescription pills just cover up the symptoms. Narcotics aren't offered very often anymore since the opioid crisis. The non-steroidal anti-inflammatories tear up your stomach, tear up your kidneys. And again, the wear and tear just keeps going on. The cortisone injections actually accelerate the wear and tear of the cartilage and the tendons and ligaments. They also make you susceptible to infections like influenza, and they're associated with an increased risk of heart attacks. Not a good idea. The joint replacement, a lot of you all say, oh, well, a joint replacement is free and insurance covers it. Well, actually, more than 50% of people are dissatisfied with knee replacement surgery at 2.5 years' time post-op. In addition to that, about 35% of people undergoing joint replacement surgery in the United States are hit with unexpected medical costs 9 to 12 months post-operatively, and the average price tag is about $4,500. This is such a big problem that the Biden administration created a special federal agency to look into this because it seemed unethical, immoral, and after the fact. Stem cells are building blocks. Think about them as cells that we put into the body, and somehow they stimulate our other cells to wake up, reproduce, have greater function, have greater vitality. Stem cells are the repair crew that your body relies upon to support healing after injury, to dissolve ongoing inflammation, to calm down the immune system when it's just completely wacko, and to improve the microcirculation. That's the delivery of oxygen and nutrients to your cells. That's always a good thing. By doing that, that stimulates healthy cell regrowth in the tissues, whether from injury or just from wear and tear. So it most commonly enhances tendon and cartilage health, but it also improves internal organ function. There are different types of stem cells. You may have heard of embryonic stem cells in the past. These were cells that we got from in vitro fertilization. A lot of ethical and moral concerns about this, and they've actually been banned in using in the United States, except for very, very specialized academic research. This is not what we're talking about. The two groups of stem cells that we most commonly talk about are autologous. That means from an individual back into their own body, or allogenic, where we can take it from a donor and give it to a different person. One specialized example of that is perinatal stem cells, where we take the stem cells from the placenta, the umbilical cord, or the amniotic fluid of a newborn, and then we give it to another individual. Now, perinatal stem cells are a wonderful, wonderful source. However, there are some constraints on using them. They're mostly supply chain constraints. We only harvest them from mothers and pregnancies that are planned C-sections where there's absolutely no maternal or fetal distress, and the mother has been pre-qualified the same way that we would pre-qualify someone for a kidney transplant. If the mother at the time of her planned C-section is having any kind of distress, or the baby is having any kind of distress, then we can't use those stem cells, or we don't use those stem cells. So this limits the supply chain, if you will. Now, when used, they are what we call immunoprivileged, so they're very, very safe in using them with other people and other family members. There are some political issues of using this in the United States. So there is also a minor risk of maternal blood if we are sourcing the stem cells from the placenta rather than the umbilical cord or the amniotic fluid. And sometimes that maternal blood, because it's much more mature than the fetal blood, can cause a transfusion reaction. Enter onto the scene something that we call fat-derived mesenchymal stem cells. Interesting. Do a little bit of a mini liposuction, take about 1.5 teaspoons of fat out of an individual, ultrasound it so that we break up the collagen capsules around the cells, and we liberate fat stem cells, adipose-derived stem cells. These are some of the most versatile, some of the strongest, the best longevity, and most active of any stem cell that we can use, especially for the majority of degenerative conditions associated with aging. I'm not going to go into all of the science here, but I do want to just show you a couple of quick slides showing that the research internationally on the use of adipose or fat-derived mesenchymal stem cells is exploding worldwide from around 2018, 2019 up until now. It is just going wild in countries all around the world because it's so unbelievably safe, and the effectiveness just keeps going up and up and up. So the most common and earliest use was in joints that were degenerated from wear and tear, and call that osteoarthritis, but it could also be due to injury, could also be due to other things like rheumatoid arthritis or Lyme arthritis, or a combination of those. And it's caused a new coining of a term called orthobiologics. Ortho meaning joint, biologics because we're using a biological rather than a pharmaceutical remedy. We're using cellular products. In general, these orthobiologics, human cellular tissue products, that is stem cells, are used in joints. They're used for tissue repair, as in burns or severe facial acne scarring, where they're used in autoimmune diseases. They're used in neurodegenerative diseases like Alzheimer's, Parkinson's, ALS, multiple sclerosis. They can be used for diabetes. They can be used for cancer pain. They can be used for post-viral immune dysregulation. It's a fancy word for things like long COVID. So the results are getting documented worldwide. Clinical studies are being done by the FDA. As we all know, the FDA is not in charge of the practice of medicine. They're in charge of labeling, ensuring the safety and purity of what is in that bottle that's labeled. And when it comes to how we use products, that's between you and me behind closed doors after complete and informed consent, with a discussion of the benefits and the risks and what the predictability is of how that's going to work for you. The use of adipose-derived mesenchymal stem cells is exploding in autoimmunity. And what's so characteristic is that it's unbelievably safe. These things help balance the immune system, and they help stimulate internal organ function as well as the microcirculation of blood, oxygen, and nutrients to those tissues that are kind of going weird immunologically. This is advancing so quickly, Big Pharma is involved, and Big Pharma has developed an adipose-derived mesenchymal stem cell product for one of the ugliest of autoimmune conditions, something called Crohn's disease, and particularly Crohn's disease, which is an autoimmunity of the gastrointestinal tract, where different areas of the lower gastrointestinal tract just become ulcerated, become pussy, become bleeding, the tissue just erodes. Sometimes it actually becomes cancerous. And so the FDA has begun trials on a stem cell product for injection into anal Crohn's disease. Just numb up the skin and do a series of injections around the anus, and magic happens. I'm telling you, this whole field is exploding internationally right now, and it's incredibly safe, incredibly valuable, and we'll talk about the accessibility and the cost in just a minute. But before we do, I want to talk about neurodegeneration. We don't have good ways of predicting who's going to get Alzheimer's. We don't have good ways of predicting who's going to get Parkinson's. We don't have good ways of predicting who's going to have other neurodegenerative conditions. However, the science is getting very, very quickly established that the use of these stem cells can push back the tide significantly. And I've seen videos of my colleagues where shortly after administration, symptoms of Parkinson's have almost completely regressed. We're now working on how to consolidate this treatment to see, can it be just symptomatically mitigating? Could it be curative? We're still working on this, but it's an exciting time and the science is only going to grow. The question is, how accessible will the supply chain be? Will we be using the perinatal products, or will we be using the adipose-derived mesenchymal stem cells? And what's the cost? And at what point does insurance cover it? Well, you know, like me, that insurance is becoming an increasingly problem in the United States. You, like me, know that we have the most expensive healthcare system in the world, and our product is not the best in the world. Actually, we are slipping every year in the quality of the product. So if you're coming to my clinic, you're paying out of pocket, whether you have insurance or not, for my services. If you've come more than once, you've come because you're getting some kind of benefit. So you are already investing in your well-being and your health. So I want to ask you some questions right now. If you have any interest income or any investment income, if you have a retirement account, an IRA, a SEP IRA, a Roth IRA, then you are investing money hoping to get a return on it at a later time. If you're collecting Social Security benefits or you're paying into Social Security, you are investing. You're investing your money hoping that you will get a return on that at a later time in your life. At a later time in your life where gravity and time and degeneration and your risk of those chronic diseases is going to continue to go up. So the government has enacted the flexible spending accounts and the health savings accounts so that Americans could put money into these accounts in much the same way that you can put money into an FSA, into a retirement account and receive a tax benefit in putting that money there and then using that money for qualified medical expenses. The qualified medical expenses have to be documented by your attending physician. I am more than happy to provide you with a medical letter of qualification for your FSA or HSA funds that get spent at our clinic, either for services or for products. Now, I'm not a CPA, but what I find on the internet and what I hear from my financial people, that in 2025, it was about $8,500 that any of us could have put into an FSA, HSA for that tax benefit. So I want to talk about this cash flow now. I went earlier today onto Google and did a simple search. What's the average price of stem cell treatment in California? And what Google said, you can look this up yourself and confirm it, but it's $5,000 to $50,000. So for example, a simple joint, according to Google, was $5,000 to $10,000. That's kind of in line with what we do. We tend to be a little bit on the less expensive side of that span. The complex joints and systemic treatments, that is treatments for conditions that are running all around the body, Google says 15 to 30,000. And for complex protocols and advanced conditions, up to 50,000. I know these numbers sound really, really big, and I can tell you that they're in line with what I see among my colleagues. I can tell you that they're also in line with what we have offered and delivered in the clinic. And I want you to just have a sense of what the cost is of medical care, either covered by insurance or out of pocket or deductibles or all these things as we age. Some studies have shown that more than 50% of the healthcare dollar in the United States is spent in the last 2.5 to 3 years of a person's lifespan. I would much rather you invest your money for deferred maintenance, for wear and tear, for rejuvenating yourself so that you can enjoy more mobility, more vitality, and have a higher quality of life before the last 2.5 years of your life. This slide shows the typical scenario of someone coming to us for stem cell therapy. They usually come in with an achy, grinding knee or shoulder. They've been told, yeah, you're going to eventually need a joint replacement, but let's put it off as long as possible. I agree with what the orthopedic surgeons are saying on that. And an average cost is about $5,000 to $7,500 for a knee. We'll typically tell someone you might need 2 or 3 injections the first year, 1 or 2 injections the second year, 1 injection the third year. But invariably what happens is patients will come in after the second injection and say, oh, my knee's aching again. And I'll say, well, which knee is aching? And they'll point to the other knee, the knee that did not get injected. Their first knee that did get treated is doing so well that now they're being held back by the knee that didn't get treated. So then we take care of the second knee, and then after a period of time, they come in, they say, could you do my shoulder? Could you do my neck? Could you do my low back? And we kind of take care of the deferred maintenance on the wear and tear of the joints. We want to spread this out over time. In some cases, some of you have come to me and said, you know what, I've got this autoimmune condition, I've done the research, and I'm just shopping for the cheapest treatment possible, blah, 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 blah. So we take those cases on an individual basis. And then some of you have come and said, hey, I'm tired of getting Botox, I'm tired of getting fillers. Could you do stem cell facials on me? And yes, we can. We can absolutely do that as well. If you look at this slide, you'll see that the pricing out of our clinic is between $1,000 and $8,000. Boy, that's a big span. Usually simple facials with stem cells are on the low end. The very, very high end is for people that have had burns or very, very severe scarring to their face from acne or other skin diseases. So just understand that. Here's the Google search slide showing exactly that we are in line with the other clinics in the state of California on the cost of stem cell facials. So there's 2 components in the pricing. One is the cost of the services, however we administer the stem cells. The other is the cost of the stem cells themselves. And the perinatal stem cells are constrained as a supply chain by that availability from those mothers with the elective C-sections, with no maternal distress, with no fetal distress, and that they've already qualified just like they would qualify for a kidney transplant donor. But the adipose-derived stem cells, which are performing equal, if not better, to the perinatal products, those prices are approximately 50% of the perinatal. So if we have a 50-50 service and product span, so to speak, and we're decreasing the cost of the product by 50%, that's a 25% savings per treatment. How do we harvest the stem cells? Well, if you've ever gone to the doctor's office for stitches, it's kind of similar. We numb up the skin with a local anesthetic, and then we go underneath the skin, and like I said, take out about 1.5 teaspoons of fat. I can get that off the skinniest person in the world very, very easily. It's not painful, and it's such a small hole that we use to introduce the cannula that we remove that with that you don't even need a stitch. A simple Band-Aid or 2 is all you need. It's a 15-minute sterile in-office procedure, painless. Here's a QR code I'd like you to click on your phone. Take out your phone, open up your camera, center the camera over the QR code, look for the little button that says whatever internet server you have, punch that button, let the website load, and then add another tab to that internet browser so that you don't lose that URL, you don't lose that tab. You can go to that and go up and down that website in the future at your leisure. There's a good There's a good video on there, and there's also some really, really great FAQs, frequently asked questions. So keep that handy, and it will give you a lot of information that we've pulled together for you so you can begin to understand the value and the benefits and have some of these questions answered. So what I'm offering now through the end of the year is the harvesting of your stem cells, growing and expanding them to we'll call it an infinite supply of your own stem cells. The current cost of those stem cells will be about 1/2 the competing agent that we would use, the perinatal stem cells. And I'm going to throw into the pricing of this your first joint treatment, especially if it's a knee or shoulder. So in order to get started, we have to set a date for your harvesting, because after we harvest, we do have to dry ice and ship that stuff off immediately to the laboratory where they process it, start to tissue culture it, and prepare your vials that will then get cryo shipped back to us, kept in our cryo freezer until we use them. If you can't wait for that processing, then I will take care of you nonetheless, so that if you're driving a long distance to the clinic for harvesting and you want a joint treated at the same time, we will do that. I'll promise you, and I'll give you preferential pricing on that. So to get this whole ball started, we have to figure out who the donor is. And I want to show you some really, really cool stuff about the donor in just a second. But sometimes we use a donor that is not you. So we have to medically qualify that person as well. To get this process started, when you go to that QR code, it's going to take you to a scheduling page, and it's going to ask you to put down a deposit of $681.42. And that will be a non-refundable deposit towards your full cost of the harvesting of your stem cells, as well as your first treatment. And the cost of that will be $10,361.12. So we're more than happy to work with you on payment plans for this, but we need that deposit in order to begin to do the medical work and the legal documentation of who the donor is going to be. Why is this donor so important? Well, I'm going to go into that in just a second. This is an example of autologous donation. The stem cells come from you and they go back to you. This next slide is showing the stem cells come from you, but even the FDA says that it's perfectly fine for me to administer it to your first generation blood relatives. That would be your children. It would also be your parents if they're alive. It would not be your spouse because she's not a blood relative. Here's the amazing thing. Let's go to this next slide. And what we see here is if you have children, you could ask your children, a child of yours, to donate. And in that way, their stem cells could be used both in you and your spouse, or we'll say, could be used in the bloodline parent of that child, because they may not be your spouse, right? And it could be used in their children. It could also be used in their siblings. So consider that your health is your greatest wealth. And if we're talking about wealth, we talk about banking and we talk about investments. So if you look at this slide, what you're seeing here is what we call transgenerational wealth. We're looking at wealth that will serve multiple generations, and it will serve both the mother and the father of the child, as well as the siblings of the child and the children of the child, with one harvesting. And the cost of those stem cells will be, right now, they're approximately 1/2 of the competing product of perinatal stem cells. And I don't think that that perinatal stem cells are going to get any cheaper going forward. So this is the opportunity. Go to the QR code and click on that. And I'll also be having my staff reach out to you to make sure that your questions on this topic are getting answered. If you have an FSA or HSA, please, please, please be in touch with us, because I think it's around $8,500 that you have available for your family for medical expenditures. We should have a serious conversation about that and get you the documentation that either the FSA, HSA, or the IRS or whatever regulatory agency needs in order for those funds to qualify. I look forward to seeing you and speaking to you soon.